the people I met in the gyn-onc division were inspiring. I felt like this was just the thing I was meant to do by the time it was kind of time to decide. The surgery is very complex and kinetic and really fun, and was a real challenge for me. And then I also really liked the patient population. So it's a real variety of people, and you get to meet them at a time of their life where you can really help them walk down a totally different path that they didn't think they would ever be on, but do it in a way that is makes them feel like they have some control and say, and make it less of a traumatic experience. So that kind of meeting people at that moment in their lives was also very attractive and inspiring to me. A lot of the same reasons that made me want to go into onc in the first place. The people here in this division were the people I wanted to be when I grew up, so to speak. They are incredibly supportive, they're cheerleaders, they really, really care and are thoughtful about the fellow education. And part of the reason, or I figured that that would be a really big part in choosing a fellowship program, is choosing a place where people really cared about you. It's a finite amount of time that you have to learn a lot, and picking a place where I knew that I was guaranteed to get that education was huge. Our fellowship director, Dr. Spencer, his whole life is making sure that the fellows get what they need, essentially. So the relationships between us and Dr. Spencer, but us and every faculty member, are very open. There is a ton of communication. There's no real barriers in that sense. You can ask anyone for anything and they would be happy to help you. We constantly are making little changes. So whenever us as fellows bring something up to Dr. Spencer, we have monthly meetings, but also could text him any time of day. And he is incredibly responsive and willing to have a discussion and get the people involved that need to be involved. I think my main focus is going to be in endometrial cancer, looking at molecular biomarkers and pathways, and essentially more objective subgroups of the endometrial cancer population that respond better or worse to certain therapies. So finding subgroups that we can better target to treat more effectively, and changing kind of the definitions or baskets we use. And I'm doing that in combination with one of our gynecologic pathologists. So there's a lot of interdisciplinary cooperation, and which is necessary for projects like this. That's luckily something I also kind of knew before I came here for fellowship, because I've seen the fellows graduate and go on to kind of their dream jobs and the jobs that they wanted to get, including some fellows that have stayed here, and I've been able to see them practice. So it's actually very clear to me that we get a very well-rounded surgical training. So we have faculty from different places, which I think is really important and something that I wanted in a program. So you learn different ways of doing things and are able to, throughout your fellowship, kind of hone your own method, but also have others in your back pocket. And I think that's important. And then also our chemo training here is very robust. So a lot of places have different ways that they teach their fellows how to prescribe chemo. Here we go to chemo clinic twice a week, every other week as clinical fellows, and we are constantly reviewing at journal club or at other didactic sessions, kind of new trials and different regimens that we can use for our patient population, and building those into our algorithms. So like those two things as kind of the core of gynecologic oncology, I know that I will be very comfortable in upon graduation. The way of life here is just easy, and this is me coming from East Coast cities before. And I think the time that you have as a trainee, as a resident, and as a fellow now is limited and precious, and to be able to use that time really well has been a huge quality of life booster. I bike everywhere. It takes 10 minutes to get anywhere. Great restaurants and great music here, which are things that I like to do. And you don't need to plan ahead, which I think is the key. Like if you find yourself free with a few hours one night, you can easily kind of make good use of that. And then I've also become kind of a stereotypical adopter of a lot of the Madison outdoor activities because it's just too easy. My apartment opens onto the bike path and I can't not go for like a bike ride around the lake. It's like so nice. I think the number one thing to know is if you come to fellowship here, you'll be supported in all aspects of your life and professional life. So no matter what your own life throws at you, you can always count on your co-fellows and faculty and even the residents to kind of be there for you. You're essentially part of a family here, and I really mean that. And then professionally, no matter what your goals are after fellowship, whatever kind of practice that you want to be in or explore, whatever research interests you have, you're always going to find someone to be in your corner and help you kind of through that process as well. And there's just no end to kind of what people will give to you here. And I think that's a special thing.